Hello, beautiful people. Welcome back to the channel. I know I've been gone for a little while. I've been moving and hence the new space. So hopefully today's episode is worth the wait. I'm going to be going over one of the most popular health devices on the market today. These devices range wildly from $50 to thousands of dollars, yet all of them claim to have tremendous benefit, leaving us to wonder if these things actually work. You'll hear about many different types of influencers, athletes, even people like Joe Rogan claiming how much benefit they get from these devices. And today I want to help demystify some of that for you. So today I am talking about red and near infrared light therapy. So if you've been hearing about red light or near infrared light and thinking about it, but not really sure about pulling the trigger, today is your day. I am hoping to break things down for you so that you can understand what this technology is, what it's actually doing at a cellular level, and the many different health applications that it can be used for, such as brain health, recovery, pain management. It has a lot of claims, so I do want to kind of walk you through why it could be helping so many different things and what things have research behind it. And then I'm going to end with highlighting one of the devices I've decided to partner with and why, just to give you a little bit of insight into some of the tech specs that you're looking for. Why are certain devices priced way above the others and things like that. So stay tuned. Hopefully today is going to be a good episode for you. But first, I should probably introduce myself for those of you who are not familiar with my channel. My name is Dr. Robin Lewis. I'm a naturopathic physician practicing in Vancouver, British Columbia, Canada, and let's get into it. All right, the very first thing that I should do is break down the different types of light for you. So for visible light, it is perceived differently because it is a different wavelength that exists on this electromagnetic spectrum. I'm going to put a photo up for you guys so that you can see. And the wavelengths are measured in nanometers. So depending on the wavelength, it'll show up on different parts of the spectrum and show up differently to your eye. And then we also have invisible light, which you will see on this chart. And that is light that exists. It has wavelengths associated with it, but you're not necessarily going to pick it up with your human eye and see that there's a blue light, a red light, the same way you would see these visible spectrums. And so depending where the light falls on the spectrum, it can have very different effects on the human body. So for the different wavelengths, we're going to have different colors. So for blue light, for example, it exists at about a 400 to 500 nanometer wavelength. For green light, it's about 500 to 570. For yellow and orange light, about 570 to 600. And then we start to get into the red light. So the red light exists around 600 to 680 nanometers. So if you're looking at a device that is promoting red light, it should have those kind of specs associated with it. And then if we have near infrared light, it's somewhere between 680 to 1100 nanometers, and it will not be visible to the eye. So if you have a device that is near infrared, it's not necessarily going to look bright red the same way regular red light would. So technically they are different things, and near infrared has a higher wavelength associated with it. So you will have different devices that have different wavelengths that they emit. Some of them will do just red light, some will do near infrared, or some will do a combo of both. And so that's why one of the devices that I chose, the Jove or the Juve, I actually don't know if I'm pronouncing it correctly, but I will flash it up on the screen so you can interpret it. So that particular device has both red and near infrared. And those are the two wavelengths that have a ton of research behind it. So those are the two wavelengths that I'm most interested in. And it's really nice to see it in the same package. So in their particular device, the red light is at 660 and the near infrared is at 850. And it focuses specifically on these two wavelengths. And that is because they will have the most research behind them. What you'll also notice with some of these devices is they'll talk about giving you multiple different types of red light. So maybe There's one that's at a 600 nanometers and then another at a 650, for example. There's actually no research to claim that's of benefit. We only really need one type of red light wavelength, if that makes sense. We don't need each at each wavelength. And so a lot of devices will promote this as an added feature. It doesn't actually have added benefit, which is interesting to note. So really, you just want a device that has something in the spectrum of near infrared or something in the spectrum of red, or ideally both, because both have a ton of really good literature to support them. Now, it's important to understand that while using one of these devices, you won't necessarily feel anything. So it's not like you can feel some sort of strange sensation on your skin as you're looking at or sitting in front of one of these devices, or if it's wrapped around your arm. There's many different forms of these devices, but the point isn't to give you a direct sensation. Sometimes when you get a little higher on that wavelength spectrum, so deeper into the near infrared, closer to 1100, it will emit a little bit of heat, and that's why you see near infrared often paired with a sauna. But the intended purpose isn't necessarily to warm you up or give you a sensation, which may lead you to believe that nothing is happening. But I would just like to point out two obvious examples to kind of debunk that a little bit for you. It is hard to wrap your head around at first because you don't necessarily feel the activity, but a really good example of this is UV light. That also falls on that spectrum, and there's no doubt in anyone's mind that UV light has an effect on the body. It'll tan you, it'll burn you, it can cause cancer for some people. So that one is also on the spectrum, very much going to affect you. You also will see radios existing on wavelengths, and you can hear that from a very long distance away. So these things are influencing you whether you like them or not. And so this is supposed to be a therapeutic device that is using light and very specific wavelengths of light for health benefits, because these are the types of wavelengths that your body likes that can have a nice, healthy cellular response, as opposed to something like UV, which is generally noted as more damaging. That being said, the big difference between red and near infrared, if we're talking about a physiological effect, is generally speaking, red exists more on the surface. So it's not going to penetrate as deep as a near infrared would. So red light exists more on the surface. It's only going to penetrate a few millimeters into the skin, which is why it can be more useful for skin-related things like improving the texture, enhancing collagen production, and really promoting good blood flow, reduced inflammation, and so on, which I will get to in a short while here, going over the more specific benefits. But generally speaking, red light, not as deep. The infrared can penetrate deeper, which is why it can be useful for things like your joints, your muscles, your organs. So if you had to just Cole's note briefly distinguish between the two, red will only go so deep, infrared goes deeper. And so that brings me to the next thing that I want to talk about, which is the specific effects of these red lights and these near infrareds. Why do we care about these, and what specific health outcomes can we expect? All right, so the very first thing that I want to talk about when it comes to the benefit of these light devices is the benefit done for the mitochondria, which is the part of your cell that makes energy. Our mitochondria is generally called the powerhouse of the cell. All of your tissues, for the most part, have mitochondria, but some do have more than others. So our really energy demanding organs like your heart and your brain have a disproportionately large amount of mitochondria, which is why they can be more heavily influenced by poor mitochondrial function that is associated with age, disease, and a lot of things. Our mitochondria will help us produce energy, and it has been shown that the mitochondria absorbs light in the 600 to 900 millimeter range of wavelength, which is exactly where red and near infrared work. So that is why those particular wavelengths of light are very helpful for the mitochondria. It has been shown that when these mitochondria absorb that type of light, it causes them to produce more ATP, which is energy. ATP is like our energy currency inside the body. And so that is a direct way that we can see it increasing people's energy. It's stimulating your mitochondria to produce more energy. If you want to learn a little bit more about some of the nutritional ways you can support your mitochondria, you can look up my episode I did on this exact topic, but in much more detail. And so that's called Tired, Optimize Your Mitochondria for More Energy. So if you want to learn about some of the more nutritional things you could do for the mitochondria, check that one out. The mitochondria does much more than just energy though. It is also incredibly important for managing oxidative stress, so combating all the damaging things we're exposed to, cellular repair, and regenerating cells when they need to be recycled and renewed. So when you have an old cell that isn't going to be useful anymore, it's just too damaged to beat up, you need processes in place to get rid of that old cell before it turns into something like cancer. Your mitochondria is going to be really helpful for that. Oxidative stress goes around and beats up our entire body, creating damage wherever it goes. And so that's another reason why our mitochondria is very helpful. It helps combat and reduce some of that oxidative stress. So anything we can do to optimize the mitochondria is incredibly important. And red and near infrared is just one way that you can support that aspect of your cells. So if we go a little deeper, I want to dive into some of the brain benefits because as I said before, your mitochondria are very dense in the brain and there's some very interesting research about red light and brain health. So your central nervous system is made up of all these nerves and neurons, and one thing that red and near infrared has been shown to do is to protect those nerves. So one study done in 2009 showed that nerve cells that are put under oxidative stress, which generally speaking will create a lot of damage and destruction within those nerve cells, when they put those cells under oxidative stress, but then treat with near infrared light, they found a protective effect. The damage wasn't as bad, the cells survived better. They've also studied this in relation to retinal health and visual improvements, and they've also found a protective effect. They think it could be due to the mitochondrial function improving, enhanced blood flow, but nonetheless, the red light did protect these different types of nerves from damage, which is huge. So there are also a lot of budding research projects that are looking at it in relation to things like anxiety, depression, Alzheimer's, and things like that. Because if you can protect the cells that make up the brain, it begs to argue that those cells will work better, there will be less disease and less dysfunction, which we have all got to worry about our brains and our brain health. Alzheimer's is like top 5 leading causes of death these days. We're all riddled with anxiety and depression, and part of that, at least in a lot of research, is that it's inflamed, it's dysfunctional, it's not recovering as well as it could. So anything we can do to really enhance the function, the repair, and the regeneration of our nervous system is going to be incredibly helpful. And red and near infrared do seem to have a lot of very promising research that suggests it's very helpful in this area. The next area of health that I want to talk about probably has the most research on it when it comes to these devices, and that is for athletic performance and muscle recovery. So near infrared, especially when combined with red light, so they do seem to work better together, really show improvements with muscle strength and recovery. So they've even done little studies in animals where they give them about a 630 nanometer wavelength for a period of time, and then they exercise them. And what they found is these animals will release less creatine kinase. Creatine kinase is something that releases from your muscles when they're damaged. So this is a chemical way to track how damaged their muscles were during the activity. So the activity didn't change, but the damage associated with that activity did in relation to using these red light and near infrared light devices. So that's really, really cool. Less muscle breakdown means less damage to repair, which is very important for recovery if you want to keep working out hard or preventing injuries and things like that. There's also a lot of literature to support that these devices can be used to enhance recovery from a torn ligament, a torn tendon, a torn muscle, a joint injury. So anything structural inside the body that needs repair appears to be enhanced by these devices. And this is something I actually have personal experience with. So earlier this year, when I got my device, I just happened to roll my ankle twice. So I rolled it really bad 1 week, 2 weeks recovery, and then I rolled it again. But one thing, and this isn't new to me, I've rolled my ankles many times. I used to be a gymnast. I have very loose ankles. They're my weak point. And so rolling my ankle isn't anything new, but how quickly I recovered was remarkable. So it had the typical puffiness, bruising, swelling, hurt to walk on, and I recovered dramatically within 1 week. I used my device every single morning. I just happened to have it around that time, and it really truly did enhance my recovery both times. The second time, I was very certain this was going to be a bigger issue because I had barely 2 weeks to recover in between, and then I rolled it again. And it did feel worse the second time around, but I've made a full recovery from both. And I would say the swelling came down within 3 or so days of using this device. My pain was almost nothing. I was careful on it because I know I should be smart and be careful on it, but it wasn't because I was in pain. I was back to regular activity within weeks of 2 back-to-back rolling of my ankle. That's a case study of 1, but I was incredibly impressed with it. It was a very easy thing to do. Just put it on my leg while I was doing some work in the morning. And it seemed to, at least in my case, really enhance the recovery. And I've had no issues with that ankle since. So yeah, I was using my little Jove Mini, which is actually quite big, on my leg for 20 minutes in recovery mode every single morning. And now this is just, again, a case of 1, but there's a ton of research to support why that may have been the case. The red light devices have been shown to enhance collagen production. So anything structural inside the body is mostly collagen. Hair, skin, tendons, bones, ligaments, all of these different structures are mostly collagen. So anything to enhance collagen production is going to speed up the repair of that wound, the repair of that torn ligament in my ankle, and so forth. It has also been shown to just enhance wound regeneration. So tissue replication and regeneration is enhanced by these devices. And there is a lot of research to support that. So this one's pretty indisputable. And it has been shown to help with the pain alongside with that. So one study done in 2023, which was super interesting, showed that it enhanced specific neurons, specifically the GABAergic neurons. So these are neurons that are known to release something called GABA, which is generally speaking referred to as like a calming neurotransmitter. So a lot of the times with nerve pain, it's because you're not getting enough GABA. The GABA will help kind of calm that pain down. And so this is the situation they were studying it in. It reduced nerve pain by enhancing GABA production, but GABA also has an anti-anxiety effect. I didn't find a direct study looking at that link with the GABA production and reduction in anxiety, but from a mechanistic standpoint, it does make a lot of sense. They were looking at nerve pain, and it helped the nerve pain, which is obviously a very good function, but it's doing that through enhancing the GABA production inside that area, which is really interesting and could have a more widespread application. If we circle back again to some of the structural things it can help with, we're talking about skin health. So this is probably one of the other areas you see it very popularized. And to be honest, it's for good reason. The red light, especially the red light that exists in about the 630 to 660 nanometer wavelength, appears to have a really good effect on the skin, enhancing collagen production, reducing bad texture, healing some of your scars, enhancing blood flow to the area. And so this is why you'll see a lot of these devices made into like a face mask or a neck mask. And that's because they're trying to really focus the red light on your face so it can improve the skin texture, wrinkles, elasticity. And a 2005 study that I looked at showed exactly that. The collagen was more dense inside the skin was more elastic, there was less scarring on the surface of the skin that was visible. And this seems to be one of the few areas where you don't necessarily need the near infrared as well, because it's really just that red light spectrum that you want, because it's a very shallow penetrating focus on the skin. Any other time where you want it to go a little deeper beyond the skin, you want to consider having the near infrared in there as well. But this is one of those few exceptions where you could probably get away with just a pure red light mask and it doesn't need that other added wavelength added to it. And now, as always, there's never enough time to go over every single study and every single application. I just wanted to highlight some of the really interesting and popular uses for it. They have seen that it enhances blood flow, so you could apply that to a lot of different things. The enhancement in mitochondria, of course, could be applied to a lot of different things. That's also why these devices are being used in like longevity medicine and stuff like that, is because it's working at the cellular level. It doesn't really seem to be exclusive to one area of the body. There are also a couple interesting studies to suggest it helps support better glucose uptake, so reducing those blood sugars, which is something, again, that all of us need to care about. Type 2 diabetes and prediabetes is very common, and so anything we can do to get the cells more able to receive that sugar, keeping those blood sugars low, is generally speaking a pretty good idea. There's also really interesting studies to look at how it can be very beneficial for the nervous system of the gut and the health of the gut. There are a lot of other uses of red light, and so I just say that to highlight some of the big ones, to really know that this is something that I do believe in. I've seen it work for myself, and the science makes sense, the mechanisms make sense. Another question, though, that I think a lot of people might have is red light can be found outside, right? We have sunlight that emits some red, but it's also mixed with a bunch of other spectrums of light. So there is an argument to be said for focusing the red light, really having just that one wavelength, not some of the other damaging wavelengths like UV, concentrated on the body, so the body can really focus on more of that restorative, reparative process rather than being inundated with a bunch of different signals. So that's kind of the concept behind some of these devices. The next thing you might ask is, what about those near infrared saunas? Because those are also very popular. And while I do also think that they're very helpful, saunas are very good for helping you sweat it out, detoxify through the skin, so you'll sweat out a lot of toxins. The heating of the body can have benefits, producing heat shock proteins. I won't go down that rabbit hole, but there's one important thing to note, that the near infrared saunas, as I said before, tend to be producing heat. They're on that higher end of the wavelength, which is really good for the detoxification process and stuff like that. But it seems to have less of that mitochondrial benefit, because again, the mitochondria can absorb between the 600 to 900 nanometer wavelength. These near infrared saunas tend to be closer to the 1000 nanometers. So they're just a little bit beyond where the mitochondria is absorbing it. So you would be seeing some of that benefit, but not all of that benefit. If it was a red and near infrared, then maybe you are getting some of the mitochondrial function. But if you're also looking into buying these really expensive devices or saunas, you also want to be sure that you're realistically going to use it, because like anything, it's just about consistency. I do not feel night and day different after one session in front of my Jove Mini. That's just not how it works. But I do over time. And so if you're going to be realistic with yourself, the red lights are a lot more accessible than the saunas. The sauna, I have to get in, sweat it out, I need to shower, redo my hair if I have anywhere to go, or whatever else it is. Sitting in front of a light is a little bit easier to do on a regular basis. It's a little bit more comfortable. Do you really want to go sit in a sauna when it's already 30 above outside, which it currently is here? Not necessarily. So that's another reason that I might lean more towards one of the light devices rather than a sauna. The saunas will cost more, be a little bit more cumbersome. I live in a place like Vancouver where we do not all have access to big yards and things like that. So it's just about accessibility and what you're trying to accomplish with it. I don't have anything against those saunas. It's just a different function and something that you're going to have to think about. Will you use it consistently? Some of the last things I want to talk about are some of the different things you can look for in these devices. Like, what is the technology being used? What's the difference between one device versus the other device? And so the first thing you need to think about, which is the most obvious thing, which is the wavelength, of course, right? You need to make sure it's in the right wavelength so it's actually doing what it's claiming to be doing. The most studied wavelengths are the 660 for the red light and the 850 for the infrared or the near infrared. And so it's not to say that, you know, a slight variation in one way or the other is going to make a massive difference, but those are the most studied wavelengths. And again, there's an argument to be said for one versus the other, but generally speaking, the combo of the two works really well together. Not to be confused with multiple combos of red and multiple combos of near infrared. There's not good research to suggest that there's any benefit of using a 660 and a 670 and a 650 all together, because they're technically all still red light. But there is some research to support the combo of the near infrared and the red light being more beneficial together, depending on what you're trying to achieve with it. The other thing, which will vary wildly from device to device, is power. The more important power measure is something called irradiance, which is the density of the power. So it's usually measured in watts per centimeter square, meaning how much power per section of skin. Obviously, bigger devices are going to generally emit more power, so that's not as relevant, but it's like how dense per light, how much does this tiny device of same size in different companies match up to each other? And so for the Jove, sorry guys, I cannot get the pronunciation right. For that one, it's around 100 milliwatts per centimeter square, or above 100 milliwatts per centimeter square. And so that's a very normal power output, but it is very important to know that more isn't always more. We always get this confused in medicine. I see it in my patients all the time, but more doesn't always equal better. So a really good example of this was one study was looking at muscle recovery and the use of these devices, and they found that the muscle recovery was actually better at the lower irradiance. And so just note that if you are seeing a huge discrepancy in price just because it's promoting a more powerful device, it doesn't always mean that that's a better device. And so we're going for therapeutic, not just what's the most powerful device. And so around 100 milliwatts per centimeter squared is roughly what I see working, but I'm sure you could go down a whole rabbit hole just on that one alone. And then of course you also just need to think about the size and the shape, because you can get a lot of different types of red lights. You can get ones that are the mask, and that's great if you just want to use it for your face. You can get those panels and short ones, big ones, enormous ones. And so it really just kind of depends what your goals are. You'll see some that just wrap around a joint. So those are obviously mostly just used for muscle and joint recovery. The face ones are just used for aesthetics and skin appearance sort of thing. The whole body ones, we're trying to achieve more of a whole body mitochondrial optimizing effect. And so I love my mini. It's portable. It goes with me if I need to go somewhere. It is extremely accessible in the sense that it's not a sauna that I have to get in and out of and do this whole dance around. So I find it very helpful and very suitable for my lifestyle needs, but that's not necessarily what your lifestyle needs are. There's a couple other reasons why I chose this particular company to work with. They use medical grade equipment. So that means insulated power cords, really high quality LED lights. They have very good warranties. They don't have a flicker. They have low EMF. So these are other things that you should be looking out for. Obviously, I'm in medicine. I want a medical grade device that I know is going to hold up over time because I'm spending a lot of money on these things and I don't want them to break down on me. I don't want them to catch fire. And I like the panels personally just because they can be used for everything. I used it for my joint. I don't need something that wraps around my joint because then I can use it for my ankle and I can use it for my face or wherever else I feel like using it. So I'm a big fan of the panel style ones just because there's multiple uses that can be done. But of course there's price differences which you need to consider, the different types of wavelengths. And so a lot of these devices, including the one that I have, is usually a 50-50 split between the red light and the near infrared, which is perfect. That's exactly what I want. And so these are decisions that you're going to have to make on your own. There's other videos on YouTube where they go into deep detail, cost comparing all of these different devices. But for today, I just really wanted to make it short and sweet. What is it being used for? Is this legit? Are these just totally gimmicky? No, I don't think so. I think there's a lot of really cool uses for this. And I very much believe in building it like something like this into your routine. It's helping your cells in a very easy, simple way. It's low invasion. I don't have to take a pill. It's low side effect. There's virtually no side effects that I can think of, especially if you're using it responsibly. You're not getting too carried away with things. I'm sure there's side effects if you really did too much of it, but I've not seen that personally. I've not seen that in the literature. They all seem pretty safe, pretty effective in the long run. You just got to be consistent with it. And that's ultimately, like a lot of these things, is it's really not about noticing a massive change right away. It's about building a habit to see these things through in the long term. You can have short-term goals with it, like managing an injury that you're trying to recover from. But most of the applications, you're playing the long game. Your wrinkles will not disappear overnight. The texture of your skin will not disappear overnight. The health of your brain, your nervous system, your heart will not recover overnight. But there is really good research to suggest that if you're consistent with these devices, they do have a pretty big impact on the body. You just need to be responsible about where you're getting these devices. So I hope that was helpful. If you have other questions, which I'm sure you will, please comment them below. If you have your own personal insights that you'd like to share, I love seeing those comments. I think it's really helpful for people to see how other real people are out there using these devices, what devices they like, and so forth. So thank you to my partners today. They were incredible. Jove, so sorry. So I look forward to seeing all your very interesting comments below. Thanks again for listening, and hopefully we'll see each other again soon.